Now we go to the basic treatment protocols, and I want to like to stress you that you could go through the 60 action brochure, and we have, for example, here now phase activation number 1 of subclavicular fossa. We go through that first, and then phase 3 treatment of the upper extremity. And you can also look our other videos there on our web pages with the similar protocols. So always choose the biggest cup that is possible, and you start with the pulsation mode with the activation of the subclavicular fossa area. Around 10 to 15 pulsations to activate the lymphatic system. After you've done the 10-15 pulsations, you start going downwards the arm. Two, 3 pulsations on one spot. Also, for the lymphatic nodes, it would be good to activate also the armpit for about 10 pulsations. If you have, for example, a cancer patient and you suspect that the lymphatic nodes are destroyed or partially destroyed, you should also treat the contralateral side, the other side, for activation. Always on the extremities, the medial side is more important for the lymphatic flow. 2-3 pulsations on one spot, and then you move downwards. You go all the way to the hand. And you come up. If you don't get a sufficient air suction into the cup, so then you just have to reduce the cup size and work with a cup that is suitable for the area. If it would be, for example, a tennis golfer's elbow, then you can work in that area a little bit more extensively and start using the lifting and twisting technique on the area. You regulate the pressure so that it feels comfortable but not painful. You always keep the cup approximately around 5 to 15 seconds in the area so that you won't get any bruising. The other good method is to work with your other hand and with the tissues. So you can work on different modes. And you go all the way up. Then for the gliding technique, you reduce the pressure and you start gliding. You can also pull the skin to the other directions so that it feels comfortable and the skin is not too loose. You tighten up the skin and then you start doing the gliding. Or you can just simply also use the roller cup. Once again, you feel that there is suction underneath, and then you start gliding. And after this, you would finalize the treatment with the pulsation mode in the subclavicular fossa area. Around 10-15 pulsations.